Well, good afternoon. Welcome to our session today. I am Marie O'Neill, and this session is part of an ongoing series called Residents and Researchers that focuses on action and solutions-oriented research on environmental health and justice issues. It's organized by the Community Engagement Core and the Integrated Health Sciences Core of the University of Michigan Life Stage Environmental Exposures and Disease Center. In the past, we have covered topics including air quality standards, disaster preparedness, healthcare waste, immigrant worker health, water affordability, and other issues. And those can be found on our M-LEEaD website, which I'll put in the chat in a moment. And we also have an advocacy board with leaders from Detroit and the state of Michigan, and that information is also found on our M-LEEaD website. All of these activities are supported by a grant from the National Institute for Environmental Health Sciences, our P30 Center. So we'll hear from our guests today and then make sure we have time for questions, and feel free to add any questions to the Q&A in our Zoom site. So today I'm really excited to welcome my colleagues Carina Gronlund, who's a faculty member at the University of Michigan Institute for Social Research, as well as the Department of Epidemiology in the School of Public Health, and Zachary Rowe, my colleague who is the Executive Director of Friends of Parkside in Detroit. So we'll be talking today about energy, housing, and health, and work that we're doing together, supporting household improvements and repairs and navigating the complex system of programs and policies along the way. And I will begin sharing our slides. And Dr. Carina Gronlund will begin with setting the stage about energy, housing, and health. And I think everyone can see the slides, and I'll put them in presentation mode. So this is the title for today. And take it away, Carina, and I'll just advance the slides as needed. And you are on mute.
Thanks, Marie, and thanks everyone for coming. So I think we're going to start by talking about how weatherization and energy efficiency relate to climate change adaptation, why this matters to human health, and I'm going to talk a little bit about what all of this looks like in Southeast Michigan and tell you a little bit about what our current research efforts are here. So sorry, go ahead, Marie.
The slide should be there.
Oh, okay. All right, thanks. So, what can we do about climate change? We can mitigate climate change by reducing emissions from power plants and from the transportation sector and the residential sector. And by reducing energy from those sectors, our energy use from those sectors, we also reduce our carbon dioxide emissions when our energy is coming from fossil fuels. We can switch to fuels other than fossil fuels. We can adapt to climate change by, for example, increasing air conditioning use and increasing access to cool spaces with things like cooling centers and resiliency hubs. And we can improve heat health warning systems and forecasting systems. The thing about weatherization is that it solves both of that mitigation and adaptation problem, because through weatherization and energy efficiency upgrades to homes, you're improving the energy efficiency of the home, so you're reducing your energy usage and then downstream carbon dioxide emissions and greenhouse gas emissions, but you're also helping the residents adapt by allowing the home to be warmer in the winter and cooler in the summer, and making the operation of air conditioning more efficient. And it also tackles a third problem, energy justice and climate justice. So it so happens that using energy more efficiently also improves outdoor air quality. So this is a co-benefit of these mitigation strategies. There's several studies that quantify this, but using EPA's AVERT emissions estimate and then COBRA health impact tools, so these are tools provided by the Environmental Protection Agency. The American Council for an Energy Efficient Economy estimated that if we had this, pretty massive reduction in electricity consumption by 15% in a single year across the country, that would result in a $20 billion savings in health costs and a 14% reduction in carbon dioxide emissions. So you're getting both these huge health and climate change mitigation benefits. Just thinking about the Midwest, Michigan is in the top 8 states in terms of avoided health costs of $600 million, and maybe even as high as $1.25 billion annually. Just kind of back of the envelope, if we were to divide that health cost savings in Michigan by the number of households, it would be about $200 per year per household. So weatherization of a single home, by that estimate, could result in health savings for that home of $2,000 over 10 years. Next slide. So, what do we mean by weatherization, actually? This includes insulation, weather stripping, air sealing, window replacement. Along the way, we can also provide energy efficiency education and also appliance upgrades as part of that weatherization definition. And along the way, as these things are being implemented, there might also be some mold remediation. We're presently studying what impacts these measures have on health. And this research can inform the sizes and features of future weatherization programs, which could result in substantial health improvements and publicly funded healthcare savings in older adults. The way that it can help improve health is, of course, with that insulation, you reduce that indoor to outdoor heat and air transfer. With energy efficiency education, so by that I mean reminding people to change filters on furnaces. You can reduce dust and mold exposure indoors. This makes the indoor environment more comfortable for people. And then this can potentially improve cardiovascular health and respiratory health and even cognitive function. If you're not sort of distracted by how hot or cold you are, it's easier to think, basically. I think we've all experienced that. You, of course, reduce your chance of getting heat exhaustion, but all of these things can also improve sleep quality. That can in turn lead to less stress and depression. And stress and depression can also be reduced with lower utility costs. And there is some qualitative evidence for that. We do have there's potential downside to health of weatherization, which is that when you seal up the home, you're potentially trapping more indoor pollutants inside, and this can exacerbate asthma and allergy symptoms. But that can be avoided through the proper installation of ventilation measures like ERVs or energy reclamation ventilation. Next slide. So there is already evidence of weatherization health benefits, mainly outside the US, so mainly in the UK, Australia, Canada, and New Zealand. There was even a randomized controlled trial of a heating intervention in New Zealand that showed reductions in asthma symptoms among children. In the US, weatherization has been linked to reduced asthma or allergy symptoms and also reductions in psychological distress in adults, although the reduction in asthma and allergy symptoms isn't seen universally in every study. The US studies have been either really geographically limited or they could be improved methodologically. Next slide. In one of these large US studies, which was conducted by our co-investigator, Bruce Tahn, he estimated what are known as non-energy impacts or the health benefits of weatherization. His team at Oak Ridge National Laboratories surveyed 665 weatherization assistance program recipients before they received weatherization. And then they surveyed a different 883 participants after receiving weatherization and he compared the survey responses, and then he monetized those health benefits. For example, we know about how much emergency department visit for asthma costs. He added all this up, and he estimated that there were health savings of about $7,800. And this number was driven mainly by the reduced deaths from heat or cold, as well as the reduced asthma medical visits. If you make additional assumptions about cost savings related to improved sleep and also to medication adherence, because it's easier to pay for medicine if your utility bills aren't as high, his estimates doubled. They went up to about $14,000. So using similar methods, Bruce has created these estimates for utilities in Tennessee and Massachusetts to use to determine weatherization assistance spending per home. And we're starting to do this in Michigan as well. So, is $7,800 a lot? Sort of by comparison, the Department of Energy spent about $6,800 per home on weatherization measures. Next slide. So what's the Southeast Michigan context regarding weatherization? So here in Southeast Michigan, we have what's called a humid continental climate, which means we have cold winters and hot summers. So we have both heating and cooling challenges. And I apologize sort of for condensing all of this history into one slide. Historically, we had the boom of the automotive industry and subsequent great migration of Southerners up to Michigan for jobs in 1910 through 1930. Like many other cities across the U.S., Detroiters of color experienced discriminatory lending practices, whereby banks restricted lending for mortgages and other home loans to neighborhoods that had non-white residents. This was called redlining because there was literally a red line drawn around those neighborhoods. Detroit also experienced the white flight phenomenon, white residents moving to the suburbs. And all of this resulted in depopulation and a reduction in the city's tax base. So this left the city with a shrinking budget and houses whose owners could not get home loans. Next slide. So I'm going to talk next about a couple of research studies that we're doing in Detroit right now. So we're presently conducting a study of the health benefits of weatherization in Detroit, Milwaukee, and also 4 cities in Tennessee to collect pre-post survey responses from the same 600 participants pre and post. And we're also gathering new information on changes in cognitive function and sleep following weatherization to improve our understanding of how cognitive function, sleep vary with temperature across seasons, as well as how they change pre and post weatherization. We'll then also monetize these results, this time leveraging new study findings, as well as existing literature on temperature and health. To do this study, we're providing all the participants with indoor temperature and humidity monitors, and then they're visited in person for the first survey. Then we call them every month about health and ask them questions that gauge their cognitive function and their sleepiness. We then ask the participants to mail their indoor temperature and humidity monitor back after 1 year. We're also doing week-long sleep measures. The participant wears an actigraph on their wrist, which is sort of like a research-grade Fitbit, and they wear those for a week prior to the intervention and then a week after the intervention if they're in the group that's receiving the intervention. And so we're hoping to recruit about 200 individuals from each state. Next slide. We're also studying an energy case manager system. So in this case, an energy case manager is someone who comes to your home and helps you identify which weatherization measures and energy efficiency measures your home would benefit from and which things you qualify for in terms of available subsidies. We've recruited about 100 participants in Detroit and gathered their utility bills. In some homes, we've also installed an e-gauge, which measures energy use in real time at a very fine temporal scale. And we also did in-home energy efficiency evaluations in all the homes and have provided, at this point, personalized recommendations and assistance to almost all of our participants. So that was, kind of an overview of the global and nationwide and Southeast Michigan context for weatherization and energy efficiency. So I'm going to turn it over now to Zachary.
Hi, and good afternoon. My name is Zachary Rowe, and I'm the Executive Director of Friends of Parkside. I'm also a former resident of Parkside, and also I'm a former research denier. And I'll talk a little bit about that during the course of my presentation. So what I'm going to be talking about is the history of the Village of Parkside, what is Friends of Parkside, a brief history of our involvement with CPPR, which is community-based participatory research. Also, I'm going to give you an idea of the composition of Parkside, and then also the planned redevelopment, and probably not in this particular order. Next slide. So this is a picture of Villages of Parkside in the 2000s. It's like your Facebook picture. You always use a old Facebook picture and not your most current one, because the old one looks better most of the time. So we use the old picture of the Village of Parkside. Just in order to talk about the Village of Parkside, before there was Village of Parkside, there was this community called Parkside Homes and Annex. It was built during the 1940s. It was built for folks returning from the war who needed temporary housing. And so like most public housing communities across the country, Parkside fell into a state of disrepair during the late 70s and 80s. It's important to note that Parkside was considered the jewel of the East Side back during its heydays, during the 40s, 50s, 60s. Parkside was considered one of the jewels. The Detroit Housing Commission was fortunate enough to receive a Hope 6 grant that allowed it to redevelop Parkside into the Village of Parkside. My understanding is that the Village of Parkside cost approximately $91 million to build. Also, the interesting thing about it is that prior to converting it from the Parkside homes to the Village of Parkside, Parkside in its heydays housed more than 1,000 families. And that was the time I lived in Parkside. And so when they redid Parkside, they actually reduced the density of Parkside. The original ideal behind the Villages of Parkside was that there was going to be 4 villages, villages 1, 2, and 3, and 4. Village 1 is sort of north where you see the vacant partial. 2 and 4 are the built areas. And so the vacant land, right there where it says Frankfurt, it was been Village 3, but only 2 of the 4 villages were built. When the Village of Parkside came online, it housed about 275 families. Today, that number is down to roughly 140 families that live in Parkside, which equates to roughly 421 men, women, and children that currently live in Parkside. Okay, so what is the Friends of Parkside? Roughly, Friends of Parkside was started by residents of Parkside for Parkside residents. I love telling this story because my mother, Catherine, was one of those women who started the organization. And over the years, the organization have really focused on youth and community development activities. We've been around since 1991. And so the fact that the organization is still here is a testament to the organization. If you want to know more about Friends of Parkside, I'm going to suggest that you visit our website at www.friendsofparkside.org, or feel free to email me at info@friendsofparkside.org. Just in terms of a brief history of our involvement in CBPR, and I started my presentation by sort of saying I was a research denier. That's true. I really didn't. I originally, I realized I really was not a research denier, but I was just a denier in terms of how research was initially done. Back during the 90s, when we first got involved with research, we were used to researchers coming into the community, collecting data, and just leaving. Or one of the things that we call drive-by research, they'll drive-by, collect data. It was really no involvement or engagement in the community other than doing surveys, those kinds of things. And so I rejected that approach when it comes to research. Fortunately, though, just working with University of Michigan School of Public Health and the Detroit Urban Research Center, we came up with a different way of doing research, and that was CBPR, which really engaged community as partners in the research process, right? And it was important for me to sort of say that because I need to anchor the type of research that we do here at Parkside. So why we do research? So residents, especially around energy, one of the things that residents used to say all the time is that during the winter, their homes was too cold. During the summer, their homes was too hot. And for the most part, we just sort of thought that that was sort of normal. But one of the things that sort of happened that really made an impact on us is that during the late 2000, early 2010, the majority of air conditioning units were stolen from the homes here at Parkside. And the management company made the decision not to replace the air conditioning units unless there was a medical reason for doing that. That means that unless you had some kind of chronic illness or you got a note from your doctor said you need air conditioning, they refused to replace it. And so just so our work with this particular partnership, one of the things that we started to realize is that, sort of the extreme heat that residents was experiencing impacted their health. And so we were able to begin to make those arguments to management and to the Housing Commission that it was important that residents had use of air conditioning. And unfortunately, that argument didn't really work as well as we wanted to work, but at least we started to be able to connect the work that we're doing with sort of what we call small P in terms of public policy. It wasn't a larger policy, it was just smaller policies. Just in terms of what's going on in the Parkside now, currently the Parkside is getting ready to go through a second redevelopment. One of the things that's being proposed for Parkside is looking at modular construction, whereby the developer bring in units that already built in the factory, just bring them on site and just sort of connect them together. They're planning to do around 150 of those units. We're not sure of the exact cost, but stay tuned. At this point, I'm going to turn it over to, I'm going to turn it over to Marie to bring us home.
Yes, thank you so much, Zachary. And I did want to, the slide that I'm showing now just mentions that Zachary, Carina, and I were here on this series a couple years back, and just wanted to share that we did talk a little bit more about some of the history of our partnership with Zachary and others. And so if you want to get some more details on things that that weren't covered today, feel free to go to that YouTube link, and that's on our M-LEEaD website. But we definitely wanted to provide you with some fresh material today. And what I am going to talk about next is some of the current research that we're involved in with Zachary, with Friends of Parkside, and with the residents of Parkside. And I'll provide a couple of the results that is part of research being led by Maddie Miller, who is a PhD student at the School for Environment and Sustainability. And it is really motivated around the issues that Carina spoke of in the introduction about energy burden among residents, in particular of lower income housing. We have a National Science Foundation grant that Carina talked about, and Zachary is one of our co-investigators, and the Villages at Parkside is one of our sites. So the work that Maddie has been leading with participation from a number of faculty, as well as our community partners through the Climate Hazards Housing and Health program. What she's been looking at is the effect of some energy upgrades that were provided to 119 of the housing units that Zachary showed on that aerial map, TVP being the abbreviation for the Villages at Parkside. And through a company called Walker Miller Energy Associates, with funding from the local utility DTE, LED light bulbs, low flow shower heads, kitchen and bathroom faucet aerators, hot water pipe wrapping, Wi-Fi enabled thermostats, and then new Energy Star refrigerators from Lowe's were provided to 119 of these units. And we enrolled 45 participants in a study to effectively assess, well, what were the effects of these upgrades on participant health as well as their energy use. So what we did was took pre-installation baseline energy, sleep, and household environment data from surveys that were administered to the participants using tablets and Qualtrics at a workshop there. And then after the installments were provided, we asked them to follow up with reporting on these parameters after the installment. And we've had a few who weren't able to do the final post survey, but we're in the process now. Maddie is leading this of analyzing the data. And we've also been collecting their utility bills in order to evaluate whether some of these upgrades actually changed energy use. There's obviously a number of other factors that can affect energy use, from season to temperature to number of occupants in the house. So some of the modeling that's ongoing right now is evaluating some of these questions. So one of the things that was perhaps confirmed with our survey was that, the folks living at the villages of Parkside sometimes have to neglect basic necessities, in part because of the burden that they have to pay energy bills. So we only had a third of folks who had to neglect some of the basic necessities, food, medicine, things like that, a third of the time. And then others, did experience these energy burdens, which are really a justice issue. The other key background of some of our participants, these 45 folks, is that we have a really high prevalence of asthma. So some of the housing quality issues that Carina talked about are particularly going to affect people who have respiratory issues, and that needs to be kept into account. The other thing that the analysis that Maddie and colleagues are currently working on is evaluating these energy consumption statistics from before and after the intervention. And we're hoping to be able to report back to the residents about, well, what happened. And we've also had some discussions with them, that the refrigerators were for the most part really welcome. And we've had follow-up through our staff with residents who have been interested in how the use of their programmable thermostats may have, either been helpful or not so helpful in their experiences. So we're working with Parkside residents, and then we've learned some things, which I summarized previously. Some of the housing, because it hasn't been updated since the year 2000, and there have been some maintenance issues. There are some health concerns that folks have that are directly related to housing. We've noticed that some of the interventions can improve this situation, not only the energy upgrade, but prior to that, we've had some home visits, and one of our community partner colleagues was able to install some weather stripping and other upgrades that did benefit the residents at Parkside. So this redevelopment that Zachary mentioned, and right now the discussions are ongoing. Our team has been meeting weekly to provide information to residents that maybe will inform how the Detroit Housing Commission and the new developer proceeds with that this redevelopment may offer some opportunities to enhance housing and health and reduce the energy burden of Parkside residents. And then they continue to participate in some of this ongoing research to evaluate the health benefits of weatherization and increasing access. So that's something that Zachary has a staff colleague, Michelle Alford, who served as an energy case manager in a prior NSF study that we have. So today, I think we wanted to really illustrate a very local application and a place where we are working collaboratively with Zachary and others on energy and health. And I want to also mention a workshop that we very recently had, also sponsored by M-LEEaD, and some of the material we presented today was covered there. But again, today the focus has been a more local look at what's going on at villages at Parkside, which hopefully may be relevant to other public housing. So that was held over at the Detroit Center, and I thank Meredith for providing some of these pictures. Carina and Tony Reams and I were speakers, and then we had a number of folks broken up into working groups, and we had some prompts. We also had LaPrisha Daniels from Detroiters working for environmental justice, and Heather Zygmantowicz with the Detroit Home Energy Repair Task Force. And we asked folks to answer a few of the prompts that are listed here, because what we know is there's a much greater demand for home improvements to improve energy and health, and we are working in the longer term. We're going to be summarizing some of these ideas and hopefully working with some of the other folks in Southeast Michigan and elsewhere, learning from examples in other parts of the country so that we can really promote energy justice and health through housing. So with that, I want to thank you for listening to our introduction of some of these issues and how they relate to public housing in Detroit. And I will stop sharing, and we will go to some of the Q&A that we have in the chat, and encourage folks to add more questions. So I'll start with one of our questions. The questioner says they're really curious to hear how the survey responses on having to forego basic necessities compares to the U.S. Census Pulse survey. Has a comparison been done or planned? I see Carina nodding, and I believe you will take this question. You would like to unmute?
Yes, I'd be happy to. It's a great question, and we used wording that was identical to the wording used in the DOE's Energy Information Administration Residential Energy Consumption Survey. And I believe the wording is identical to the Household Pulse survey. I just pulled it up. And so the question is, in the last 12 months, how many months did your household reduce or forego expenses for basic household necessities such as medicine or food in order to pay an energy bill? Now, in over the past several iterations of the Residential Energy Consumption Survey and the Household Pulse survey, about 20% or 1 in 5 of the respondents nationwide has answered that there was at least 1 month in the past 12 months that they had to reduce or forego necessities. Ours, Marie, I think you said it was around 30%, 31 in 3.
Let me pull the slide. It was actually 34% who didn't. So
Oh, okay.
it was bigger than that. So let me just let me look at that slide to give you the exact number, and I can share that. So yeah,
So,
so
yes.
some or more was like 60%. There was a few don't know, but yeah, what I'm looking at
Okay.
is, yep, 60%.
So triple
more. Yeah.
Triple the incidence of the heat or eat dilemma. And I don't know if any of us mentioned that, but that's sometimes called the heat or eat dilemma, where you are having to choose between paying utility bills or paying for food or medicine or other necessities like rent.
Yeah, thank you, Rowe, for that question. Yeah, so much higher at the villages of Parkside. So another question says, has the research looked into effects of extreme heat events?
Yeah, there's a lot of prior research, some from our own group, on how rates of mortality and emergency department visits and hospitalizations rise during extreme heat events. And they rise, pretty substantially in Michigan. We've also, been doing some research into sort of what the particular characteristics of vulnerability are to extreme heat, with the hypotheses that it does have a lot to do with access to cooler spaces. And we've examined that as much as we can using these large administrative databases. And so these opportunities to do survey research and to have, both the sort of like quantitative and qualitative input from the communities facing these, facing this burden of extreme heat, really helps us better understand what interventions to recommend. In terms of our own survey research, it's hard to actually align the survey period with an extreme heat event. I think, I don't know if we've ever been able to actually be kind of in the middle of a survey administration or a data collection period while there was, a major heat wave going on. So it's one of the, you sort of need sort of evidence from all sorts of places to be able to understand this problem and propose solutions.
Yeah, and I'll also just share that, our group here, including Natalie, when she was a student, had, we did quite a bit of, qualitative research, speaking with people, including residents of Detroit, about what were their experiences during extreme heat. And I think, that definitely complements some of the research that documents health effects. I'm wondering, Zachary, if you have any comments on that, just in terms of, the residents you serve and their, I know we've heard a lot when we've had community meetings, but any thoughts from your perspective on terms of how extreme heat affects folks in Parkside?
Not directly. I think, my experience with residents have just talked about, how warm their units are, during the summer months, and just thinking about how it impacted their health. And so that's why we encourage residents to apply for a medical exemption so that they could get access to health air conditioning in order to be able to avoid that. And also one of the things that we did is that we made sure that residents sort of knew about those warming centers, so that if there's close cooling centers, so that, if they get too hot, there are places where they can sort of go to cool off. And I think it's something for us to really think about and monitor as we go forward, because we already know that we're going to have probably more extreme weather events in the future. But thanks for the question.
I see some other great questions coming in, but I just want to add to that a little bit. Like Marie and I think Marie especially comes from sort of the more traditional environmental health, like air pollution world. And one of the big differences between temperature as the exposure and air pollution as the exposure is I think people are a lot more aware of the temperatures they're experiencing than the air pollution levels that they're experiencing. And so it's an opportunity to gather more qualitative data and say, hey, remember that really bad heat wave? You know, what were your experiences and what did you do about it and what should we do about it as a society? But then, you know, in contrast to that, you know, Zachary brought to our attention when we were designing one of the surveys that the experience of heat exhaustion can be so normalized for some people that if you ask them what their experiences with heat exhaustion have been, even if you define what that means, you know, you're still going to get maybe some puzzled looks. So it's sort of both an exposure that you can be very aware of or an exposure that you may not be very aware of.
Yeah, thank you. So we have another question. I'm curious to see if there were any policies being passed or anything happening politically that influenced this study. And I'll just say, you know, I think part of what made the study that Maddie Miller is working on and we're all working on together possible was that the National Science Foundation opened up a call for proposals called Smart and Connected Communities with the kind of explicit understanding that more research needs to be done in partnership with communities. And the idea was that, you know, energy burden is great. It's a disproportionate burden. It's a climate justice and environmental justice issue. And so if we have technology that can help people better understand how they're using energy in their homes, perhaps make better decisions, you know, DTE offers different rate plans that can help you save money. And in some cases, be connected to services that provide weatherization or improvements or better appliances, that really can go a long way towards enhancing justice. So I'd say, you know, sort of the big picture, whether that's politically or just, you know, the scientific funding structures, really recognizing the need for community-based research that does focus on rectifying injustices if possible, or at least providing information that can be used. That's one thing. I think, you know, currently under the current administration, the Biden-Harris administration, there is so much funding now with the Justice 40 program that really is intended to address energy injustice and environmental injustice. And I don't know that that necessarily influenced the study that we're currently involved in, but it certainly influenced our conversations around, you know, perhaps when Parkside is being redeveloped, the developer, the various funding agencies can consider sustainability and, you know, more environmentally friendly materials as something that can be a win-win for people's health as well. So I open it up to Zachary to, you know, kind of talk about the policy context, because I know you are on the front line, particularly working in Detroit and with the agencies that, you know, you interact with for public housing.
Mm-hmm. Yeah, I guess I'm just curious about the question when you say politically. You know, I that sort of made me think about the federal policy. But you know, I think for me, a lot of the policies though are local. Just, you know, the decisions that are being made by the Detroit Housing Commission or by the management company. I think those policies really impact what happens here at Parkside. Not saying that sort of the city, state, and federal policies do not impact, but for the most part, you know, I think those ones that we sort of see immediately are those that get implemented by the management company and DAC. And I think for me, just sort of going back to when the policy or the decision to not replace air conditioning really got my attention, especially as it relates to this issue around heat and energy and those kinds of things. Yeah.
Okay, thank you, Zachary. So it looks like it's Raoul asks another great question. Was there data collected on outages in Parkside, number of outages, length of outages, time until restoration, etc.? I don't think we collected data, but Zachary.
That's a great question, and I'm quite sure if we talk with the residents, they can definitely tell you when they had outages. And I since our office is located at Parkside, I don't remember experiencing any outages Monday through Friday, 9 to 5, right? So there were outages that probably happened after 5 on weekends or when our office was closed because, if the power went out, we would definitely know. But residents did talk about having different outages over the past couple of years. But I think Marie sort of said to me, our study wouldn't pick up any outages, right? We don't really track it like that.
Marie, I don't know if you're monitoring the questions in the chat as well. There's a couple of questions.
Oh, I wasn't. No, thank you. I was just looking at the Q&A. So are there questions in the chat?
Yeah, there's one here. Curious if any of the Parkside community residents are living off the grid and lack other basic resources like drinking water.
Yeah, I guess I'm not sure about what's meant by off the grid. I think when I think of off the grid, I sort of have this different perception of off the grid. So if the person who asks the question wouldn't mind clarifying off the grid, that would help me to respond. Or unless Marie and Carina sort of knows what that means already.
Yeah, I will say that the person who typed this in, and they're welcome to add more. Okay. They say they don't have an electric bill, for example.
Okay. Everyone at Parkside have to have an electric bill and have to be in your name. Otherwise, you can't live here. So it's hard for them to live off the grid in that way. But one of the things that we learned from doing a project, the case management project, is that if folks have trouble paying their energy bill, they also have other needs in terms of food assistance, medical, employment. So there are other issues that's going on. So energy is just one of those things that they have to deal with.
And there's another question in the chat. Does this study also focus on solar energy solutions for the city of Detroit? We are not really focused on solar energy. It has come up with, when speaking with participants from other parts of the city, but Carina, please feel free to say something about that.
Yeah, so my engineering colleagues tell me that solar, if your goal is to reduce your utility bills, solar is kind of the last thing you do to your home. You first want to replace appliances and do those other weatherization measures, and then you can start to think about solar. Solar is useful if you have a way of storing the energy in a battery. It is useful for emergencies. So it has benefits there. And one of our other community partners, Ron Washington at EcoWorks, I think at one point was providing small solar generators, like probably enough power to charge a cell phone or something to residents. I think there is some research. I think we're about to get started on another NSF project with one of our community partners on so I'm not the lead on this, but it's like a sort of decarbonization ready effort. So thinking, sort of making sure that you stack the services, the weatherization services that you're receiving, so that you could eventually, or that you are sort of actively electrifying your energy sources, like getting a heat pump, another, sort of shifting away from natural gas as your energy source, so that you could eventually power that with solar.
And I see there's a couple of comments in the chat, and I do want to acknowledge one comment in particular from one of our staff and resident who pointed out that there was a power outage a while ago that had to do with one of the, I think, transformer exploding. And then also there's a question from one of our board members that sort of talks about Parkside in the planning stages of major renovations. That's the redevelopment we talked about. Have the resident representative advocated for energy efficient measures. And I do want to say that sort of came up in a couple of conversations. And I think through this project partnership, one of the things that we wanted to be able to do, have some conversation with the developer and the DAC about what does that sort of look like. The fact that they're using a modular homes in the process, I think part of the assumption is that those homes are already energy efficient to some degree. We just don't know what that sort of look like in the long run. So stay tuned. And I'm going to open that question up to Maria and Carina as well.
Yes, well, I'm aware that this webinar is supposed to go until just 12:52. So I'll just say yes. I want to thank one of the Parkside residents who's on the call confirmed power outages with an explosion, and yeah, I think I think. It's up to the resident representatives whether they want to advocate for energy efficient measures. But our team and, with Zachary, it's definitely about providing whatever data that we can, whether it be data directly collected from Parkside or, data that we know about from other studies and research. So, this is one of the, privileges and opportunities that we have in having this long-term collaboration and, personally knowing many of the residents, that hopefully the research work that we've done can be helpful to residents for, advocating and ensuring a better quality of life at the villages of Parkside. So with that, I want to thank everyone for joining us. Thanks to the audience for some excellent questions and insights. And please stay tuned for future seminars, and also, feel free to reach out to any of us if you have follow-up questions or ways that we can collaborate. So thanks all. Thank you, Zachary, Carina, and all of those who helped us organize today's event.